Okay, good afternoon, lovers of freedom. Today is the 17th day of September 2025. We just came out from a visit to MAZI NNAMDI KANU, who is in solitary confinement at the DSS. We had a meeting with him a short while ago, and this is the message he has sent, or he has asked us to send out to the world concerning the status of his health. This is the MAZI NNAMDI KANU talking. The SSS, through their doctor, who was brought to replace another more competent doctor that actually discovered that he has a very dangerously low potassium in his bloodstream that can trigger heart failure at any time. This doctor, who is of DSS, is fully aware of the seriousness of the potassium depletion in his blood system. And yet, the DSS took samples of his blood system, his blood samples, to South Africa for analysis. The South Africa authority, after analyzing the blood sample, queried why the depletion of potassium in his body. The lab people in South Africa could not give any reason for the depletion of potassium in his system. The DSS facility here has also not been able to show or give reason why the depletion in potassium is consistent and persistent in his blood system. And the question MAZI NNAMDI KANU is asking is, if there is nothing wrong with him, then what is the reason for the taking of blood samples from him for almost over 50 times? Why the consistent drawing of his blood in the name of going for analysis for more than 50 times? Why is it that his potassium continues to deplete despite all the medication that the DSS have been giving to him? To NNAMDI KANU, he strongly believes that the medicines given to him by the State Security Service and medical department is of no effect whatsoever. He also wants the world to know that he may have been poisoned in Kenya to the knowledge of the Nigerian authorities, but yet the Nigerian authorities choose not to give him the adequate medical treatment that he needs for his survival to face his trial. NNAMDI KANU wants us to know that since he was born, he has never suffered diabetes before, nor has he suffered anything post-trem before. But due to the depletion of the potassium in his body, so many things have started going wrong with his internal organs. His pancreas, his prostate, and so many other things. His heart, so many other things. The kidney function is not functioning at optimal level. It's MAZI NNAMDI KANU's belief that the Nigerian judiciary is seriously being intimidated by the authorities. And that is why it appears that the judiciary is not helpful to him when it comes to issues of his health. Professor Araji, Professor Emeritus, a medical doctor, who is currently leading his medical team, had deposed to affidavit stating what he found that is wrong with MAZI NNAMDI KANU and recommending that MAZI NNAMDI KANU be taken before the National Hospital, which is a federal government-owned hospital, for proper medical attention. But unfortunately, the federal government of Nigeria, through the State Security Service, have refused to see reasons why he should be taken to the National Hospital that is here in Abuja. it is interesting to know that at each point in time that MAZI NNAMDI Kanu's medical checks was being conducted, the DSS will normally send 2 or more of their own in-house doctors to witness all examination. And they are fully aware of his medical condition. They are fully aware that since they kept giving him those medications they used to give him to improve his potassium, that it has not worked. His potassium continues to deplete, and this can lead